Ankylosing spondylitis, or AS, is a type of arthritis that primarily affects the spine. It causes inflammation and pain, particularly in the lower part of the back, where the spine meets the pelvis. The term ankylosis refers to the fusion of the joints, while spondylitis means inflammation of the spine. This condition is part of a broader category known as axial spondyloarthritis, which involves inflammation in the spine and can affect other joints in the body. It's also within a broader group which include psoriatic arthritis, enteropathic arthritis, and reactive arthritis, which are the seronegative arthritis conditions. While the inflammation in the spine is the hallmark of ankylosing spondylitis, the condition can extend to other parts of the body. For many people with AS, the mornings are particularly difficult. The stiffness and the pain can be worse in the early hours of the morning, making it challenging to straighten or twist the body after waking. This can often result in fatigue due to disturbed sleep. Prolonged periods of sitting down or standing in the same position can also exacerbate the discomfort. One of the primary areas affected is the sacroiliac joint, which is located at the base of the spine, and this can cause pain to go into the buttocks. In addition, other joints in the body can experience swelling and inflammation. In some people, they may develop painful red eyes in a condition known as iritis. AS is also linked to inflammation at the points where the tendons attach to the bones, a condition called enthesitis. This can lead to inflammation of the Achilles tendon or at the plantar fascia underneath the foot. For many, exercise can be difficult during flare-ups as it worsens the pain. However, regular stretching and physical activity are essential parts in managing AS and maintaining flexibility. AS typically begins in young adulthood. The condition is most often diagnosed between the ages of 20 to 30, but it can be delayed for many years. This is because the symptoms often start in the late teens or early 20s, and patients may experience a significant delay, sometimes up to a decade before getting a proper diagnosis. It was thought that AS affected men more than women, but recent studies seem to find that gender difference isn't quite as pronounced as what was once believed. It's more common in people of Caucasian descent, with North European populations reporting the highest rates. In the UK, ankylosing spondylitis affects between 1 in 500 to 1 in 1,000 people. It's less common than other forms of arthritis like rheumatoid arthritis, but still a significant health concern. The average age of diagnosis at around 32, but as mentioned earlier, the symptoms may well have started much earlier. AS is more prevalent in individuals who have a family history of this condition. The exact cause is not yet fully understood, but it is believed to be linked to the immune system, with a particular focus on certain genes involved in the immune response. One such gene, called HLA-B27, has been identified, but this is found in up to 8% of Caucasian population of the UK. While carrying this gene increases the risk of developing AS, it's important to note not everyone with HLA-B27 will develop the condition, and only about 1 in 15 people with that gene will go on to develop AS. Like many immune-related diseases, it's thought to be triggered by an event such as an infection, an illness, or a period of stress that prompts the immune system to mistakenly attack the body's own tissues, leading to that inflammation. For many people, the biggest challenge is getting the referral to the specialist. This is because back pain is such a common complaint. Many of us will experience it at some point in our lives. However, there are certain signs that might suggest this is AS rather than ordinary so-called musculoskeletal back pain. For example, if the pain is starting at quite a young age, if it's alternating and affecting one or the other buttock, is worse in the morning and improves with exercise, this could indicate an inflammatory condition like AS. During the medical consultation, doctors will ask about related conditions like psoriasis, inflammatory bowel disease, or symptoms of inflammation in the eye, like iritis. To make a diagnosis, the doctor will then move on to a physical exam to look at the range of motion in the spine and check for tenderness in areas like the sacroiliac joints. Blood tests such as the C-reactive protein or ESR can indicate the presence of inflammation, while the HLA-B27 test can be used to see if you're in a higher risk of developing the condition. A positive HLA-B27 does not, of course, guarantee that this is AS, however. Imaging tests like an X-ray can be helpful, but it can take many years for changes to happen. An MRI can detect the presence of inflammation much earlier on. Modern MRIs are much better, but it's crucial that these scans are interpreted by specialists. They need to be done with specific techniques that focus on inflammatory change. Some newer technologies like PET scans may help in the future, but they're not widely used. When it comes to managing ankylosing spondylitis, treatment is typically coordinated with a multidisciplinary team, with the rheumatologist leading this team. The treatment plan usually involves a combination of medication, lifestyle change, and physical therapy interventions. Early education is an important part of the process in helping people to understand their condition, the treatment options, and the importance of staying active. People are often referred to support networks or educational groups where they can learn more about the condition and share their experience with others. One of the first treatments usually offered is a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. These drugs help reduce inflammation and ease pain, but they're not suitable for everyone, especially those with asthma, digestive issues, and other health conditions. If this is not effective, or if you're unable to take these, doctors may recommend other agents. This could include disease-modifying anti-rheumatic drugs, and particularly for spinal inflammation, targeted therapies such as biologic drugs. Along with medication, non-pharmacological interventions could include heat therapy, acupuncture, or massage. Physical therapy, as we've mentioned, is key, especially exercises and strengthening of the back. It's crucial to maintain mobility, and this helps ease stiffness. In some cases, hydrotherapy can be involved, which is a type of water-based physiotherapy. In some cases, surgery may be required because the spine has become inflamed for so long it has fused. Thankfully, newer medications and targeted therapies have substantially decreased this need. While ankylosing spondylitis still presents many challenges, ongoing research and modern medical treatment strategies are certainly improving the quality of life for those living with the condition. If you suspect you have an inflammatory back pain problem like AS, and you've been living with chronic back pain, it's important to consult with a healthcare professional who can guide you towards the appropriate diagnosis and make a specialty referral if indicated.